Next, we have Ann Arbor Public Schools Reimagine Learning Plan. So we'll have some updates. Dr. Swift.
Thank you. President Johnson and trustees, we appreciate the opportunity tonight. Is this volume okay, Mr. Clerk?
Yep.
Okay, good. Thank you. We appreciate the opportunity this evening to revisit the Reimagine Learning Plan. I do appreciate the remarks from our public commenters this evening, because you are correct. We wanted to get the information out so that our parents could begin to think with us and to, I've said to folks this week, we got the house and now we're going to arrange everything inside the house. And so we really appreciate literally hundreds of emails and various other contacts from the community. We will be setting out this evening some more ways that folks can weigh in and give us input and feedback as we move forward. The goal this evening with the update, trustees, I know you're familiar with the fundamental components, but our goal is really to drive into what it is that parents need to know and students need to know in order to think about their upcoming decisions about school for 2021. Following this piece this evening, I will ask Ms. Bacalor to come up and help us because we're getting a lot of questions about what will happen when we have a case. So Ms. Bacalor is going to kind of walk us through that. It won't take too long. And then under first briefing, trustees, safety and health is our #1 priority. So we'll be looking at a more technical look at how we propose to keep all of our adults as healthy as possible, and also the protocols for students at school during the day. We feel like that's important for parents to know in order to make their decisions. So we're really being very intentional about setting out what we think our parents and community will want to have answers to. The Reimagine Learning Plan, I just want to say up front, because I felt like from the feedback last week that perhaps I didn't just publicly acknowledge how much we wish we were preparing to welcome our students back in person. That is our desired outcome, and we are determined to offer the best program anywhere, and we know that everything about our work may look different now, and yet our critical mission of every child every day will remain the same. And I just want to share that I've heard from staff members, hundreds of staff members, and I know that everyone on our team is deeply committed to bring the same innovation and creativity and engagement that we bring to the in-person classroom every day. We'll be bringing that same level of engagement to our virtual setting. We will continue to work hard every day. I have used this quote shared by a psychologist, Lisa D'Amour, that said, "I know this is not what you want, and I cannot tell you how much I wish things were different. We'll do the best we can with the options we have, and we all get that we're unhappy with the options that we have." And I've used that quote not with other people. I want to be clear, I'm not sharing that for anybody else. I've used that quote with myself over the previous 4 months because we are determined to offer the very best product, and yet in order to keep our students safe, we have to put that educational experience into a virtual environment for the opening of school. So our activities this evening are that we'll clarify the Reimagine Plan. Trustees, we're following about 10 of the most commonly mentioned themes and patterns in all of the information that we've received from folks this week. We'll have Ms. Bacalor attend to a public health update about what happens at school when a case is identified, and then we'll talk about next steps. We do have our principles, our guiding principles and core values, but I want to touch on one that one of the speakers, actually two of the speakers mentioned, and that is our commitment to social justice and anti-racism. And that idea of we are working every day to achieve equity and opportunity. We want to be very explicit that we are attending to ensure that Black and brown students who've been traditionally underserved have every opportunity. And so the question we ask of all of us in this Ann Arbor community is, in what ways will we hold ourselves and each other in continuing conversation to ensure that we are achieving direct action steps, and as a speaker mentioned this evening, metrics associated with those steps around our work to ensure a foundation of anti-racism and social justice. You know, John Lewis's words resonate with all of us, and that is that we plan to get in the way to make sure that students have the opportunities they deserve. Now is the time, while we're redesigning with the Reimagine Plan, now is the time to help each other and to hold each other in conversation for Black and brown students and for students from poverty, and understanding, as speakers mentioned this evening, that today, July 29th, we have more students in poverty now than we did when we had to send our students home on March 13th. We understand that our students have experienced trauma, our families have experienced trauma, and we're going to keep these things in mind as we put together the plan. So you note, trustees, that as we've done since March, this presentation is set along Maslow's hierarchy. So we start with those foundational needs first, and I just want to reassure our community that our food distribution will continue and will remain, thank you, Ms. Osinski, will remain strong. We have just passed 415,000 meals distributed. We have not missed a day or a week since March 16th, the Monday after we fed our students lunch on Friday, March 13th. That distribution is occurring 2 times per week. Today, Ms. Margolis reports that we've been able to extend the summer distribution all the way through September the 4th. And so that's an extension. And we are adding, so many of our parents are working and they're busy. And so we are adding a late afternoon drive-through distribution at Pioneer High School. It will also be on the same days, Tuesdays and Fridays, 4:30 to 6, and folks should enter along the South 7th Rec and Ed entrance at Pioneer High School. I just wanted to share this picture that caused us all a great deal of joy yesterday. 700 homemade blueberry muffins that were distributed yesterday to our students. We're serving anywhere between 1,500 and 2,000 students a day since March 13th. We do expect that that number will remain strong or may even increase this fall, but I want to reassure our community that we're busy about meeting the foundational food needs for our students. I do need to give a shout out to Chartwell's in Durham, in our Ann Arbor Public Schools volunteers, and also to food gatherers has been a tremendous partner to us. We've been able to distribute a lot of the bigger food boxes of shelf-stable foods along with our regular lunch and breakfast and lunch meals for students. Trustees, you know that we are seeing this catch up, keep up, and move up academic process as a 1 to 3 year process to ensure that our students, go ahead, Ms. Osinski, that our students have everything they need to ensure that those academic areas that have perhaps had some time out here and there, that we are attending to those. So while many districts closed their learning for summer because they were overwhelmed, and we understand that, I want to give a shout out to our 350 teachers and leaders and staff members who rewrote curricula, who organized tremendous programming. And I want to thank our students and our parents, 4,500 students participating. Now, some for part of the weeks and some for every week of this summer program. So you can see there elementary, middle, and high school, the adventure games, the English as Second Language Academy, our middle school summer challenges, ESL Academy, our Scarlet Learning Academy, and then high school has been incredibly busy with over 2,000 students enrolled. And that's our English language bridge into high school. The Academic Youth Development Trustees, you remember, is an in-depth math program. Our SAT prep, our traditional high school summer school program for students to get credits to either catch up, keep up, or move up, our A2 virtual. And then we had an entire program, trustees, dedicated to students who did not complete their work in the spring. So as Mr. Rourke mentioned in the comments, we were following up on the data from spring, and every single student who was unable to complete, we did dedicate a program to ensure that we got those students as they were able, got them back on track. Our special education programming over the summer, about 450 students. Our extended school year, we do that every summer. We also have had Project Read and that SISS Summer Academy, which is really service provision. So I want to give a shout out and a big thank you to all of our service providers, our special education professionals who've been providing services over the summer. We want to make sure our students are on this path to stay engaged and to catch up. And trustees, it's been a great summer. Now, we've been using some of the tools, and you'll hear next about the Schoology update. As you know, trustees, it's going well at secondary, although there are bumps along the road at all 3 levels. And then there are some issues at elementary. Ms. Dr. Kellstrom will be coming forward to share more about that shortly. Just a reminder to everyone, we look forward to seeing all of our students virtually on Tuesday, the morning after Labor Day, September 8th. So trustees, just yesterday, that's 6 weeks from yesterday. So we are on a mission, we are focused, we are mission driven to get all of our plan put together, to hear input and feedback from our families. That week prior to September 8th will be the week of preparation. So we have had trustees, not everybody knows it, but we have been supplying all of those materials that students need at home to do their work, pencil and paper and Scotch tape and all that kind of stuff to do their summer learning challenges. We've been providing that at home for students in need. And so this week of August the 31st, we'll ask in a socially distant, healthy, and safe way for our families to come through and pick up their supplies and materials, make sure their technology has been tuned up. Trustees will be talking more about technology. Every single student in the Ann Arbor Public Schools will have a device. Those devices will be preloaded and customized for the grade level with all the learning applications preloaded. That just makes it a lot smoother getting in and out of our system. You'll hear more trustees about the reading materials that we're working to have loaded so that every student will have a library available to them, connections through to the AADL, of course, but then also a library of their reading materials for their grade level. So that's kind of our timeline. Now let's talk about the rationale. I've had a lot of email to ask us to explain the rationale. I just want to point out, Ms. Osinski's going to back up just about 3 slides there. We know that we're all thinking about the children we have at home, and yet trustees, you have to think about not only the children you have at home or the children that you're close to in this district, but as trustees, you also have to think about the big picture. The reality is, as the 4th largest district in Michigan, any day we call in-school learning, the result of that is at least 25,000 people, individuals, have to leave their home. So in a time of a pandemic, we do have to give that the serious consideration that it deserves. So here are the metrics that we're looking at. I appreciate Trustee Gaynor touching in on some of those. We look at the rate of infection. I am not the health expert. Ms. Baccalor is coming along, but I do want the community, the trustees, to understand that we do have a clear data dashboard. It is the Reopen Michigan region, the Washtenaw County data, the Michigan case data, and the U.S. case data. We are also looking at emerging research around the impact of COVID on young people, on small children, on bigger children, and on adults. We're learning more about that every day. The truth is, our young people have not been together in a school setting. By the time we come back, it will have been 5 months, a little over. So we know there will be a lot emerging as we head into this back to school season. A lot of good data will be forthcoming. I do want to point out, these are the metrics on the next slide. You can see our risk level as a region, where Washtenaw County is, our coronavirus cases, both in the state and nationally. The next component, I just want to be sure that this part is not misunderstood. So I want to open with, we love being a university town. It's what makes us who we are in Ann Arbor. So I hope no one will misconstrue this next component of the data we have to look at. We know we're one of the top, in our opinion, we are the top college town in the U.S., and yet we also understand that the other side of that right now is that as college students migrate all over the country, they'll be migrating back to their college towns. And I understand that college students do that, whether they're on a virtual for some of their classes or whether they're in person. That's just the nature of it. We do understand that we'll have potentially more than 40,000 higher ed students, and that's just U of M. And then we look at our neighbors, our neighbor universities that are in the region. We'll have many thousand college students coming back into the Ann Arbor area. Just real quickly, where do these folks come to us from when they get on a plane or get in their car in mid-August or the 1st of August, whenever they start their trek back to college? They come from 82 Michigan counties, from 50 states, and from 139 countries. Again, this is what we love about our hometown. but it is also another piece of data that we will keep in mind. The top 10 areas that they arrive from, states inside the U.S., this is in the order, trustees, in the order based on 2019 fall data. California, Illinois, New York, New Jersey, Ohio, Florida, Massachusetts, Pennsylvania, Maryland, and Texas. So we can surely see some hotspot areas inside that. So we will be monitoring through September to see how that impacts us. And I want to be clear, we're not saying that we need weeks of declining rates. I want to be clear, that's not what we've said. We will need to achieve very low rates of transmission over a sustained period of time. As Trustee Gaynor noted, we were there for a short period of time earlier in the summer. I do need to clarify, I've received several emails on some comments that have been made. The goal, according to our public health experts, is not 0 cases, because we know that with the pandemic, we're likely not to get to 0 for quite some time. I found this quote, and this is a emergency physician whom I follow, and she actually had this this piece in the Washington Post yesterday, and her advisement was to hold off on in-person until October. We had already made that decision, but it's the latter half of this quote that I find interesting. This is from one of our many medical health scientists that we engage with. She indicates it will take 3 or 4 weeks for new restrictions to have an effect. Our new restriction that we're very pleased that the governor has provided is this one. I have mine right here close tonight, wearing our masks at all times in public so that we're sure to, we wear our mask, not so much for ourselves, but for others. And so this is the new restriction that we've had in Michigan. She indicates that those would take 3 to 4 weeks for the new restrictions to have an effect, and then a few more weeks to make sure that the trend holds. So trustees, we've discussed a lot in our meetings about setting a timeline. You look at the newspaper and a lot of districts are saying October 15th or November 30th. They're setting dates on a calendar. I agree, trustees, with what you all have guided us, and we agree, and our public health experts agree. There's no putting a date on this pandemic as much as we want to know a date, but we wanted to set out the metrics and just help folks understand that it isn't a mystery. We are looking at about 6 data points, and we are looking at them over time. We are still concerned about emerging research, and I won't go through that again because we talked about it last week, but I left the slide here in case folks missed that presentation last week. And then trustees, the 3 fundamental areas, and I know that in our small briefings, we've all had these conversations. We need readily available testing and timely results. And from our reading this week, our health experts are saying that's 24 to 48 hours. Trustees, it's no secret. It's apparent that we have cases in our community, and in fact, we have cases in the district that we have to deal with. So I will just share with you from personal experience, our most recent case, it took 4 days to get those results, and that was actually better than it has been in many other situations. But if we were back in in-person school, 4 days before knowing of a case would be detrimental. It would be disastrous for all of the students and the other adults in that school environment. So number one is we're lobbying, and trustees, I know you're lobbying state and national levels. We need testing. We need timely results. We need adequate contact tracing. Ms. Bacalar is going to share with you. She's mobilizing a COVID response team. I'm so excited to meet them and get to work with them. We will have a team on this work. They will be trained and they will be ready. We know that our Washtenaw County Health Department is also committed to this work. But as long as infection rates are at high levels, the contact tracing process cannot keep up. So this is something that we continue to want to see more coordinated response to. And then thirdly, we want to assure that we have sustained supplies of PPE. And I know some folks were disturbed last week at my reference to this. They thought that perhaps I was being political. I want to reassure the community there's no politics here. We have children in our charge and adults who care for them. And the protocol is that they must wear masks. In many cases, they will need face shields also, particularly at preschool and in some of our medically impacted student situations, our self-contained classrooms and mini classrooms. They will need face shields. Some of our employees, food team, nursing team will need full PPE gowns and gloves. Trustees, as you know, we have received delivery on our first order. Ms. Bacalar is not sure how long that will last us. We suspect it's about 2 months worth. And that initial order was just under $1 million. So we're going to do that because it's required and it's important. We do it because it's the right thing to do. We also do it because it's required. But we also have an eye on the federal stimulus package to benefit schools, because we will need not only the funds, but we will need the assurance that these materials and supplies will be readily available when we get back to in-person school. So I did want to mention also the CDC guidance. We didn't write this. This is in the CDC guidance. We put it here to assist our parents as you're thinking about your choices for fall. The CDC guidance reiterates that the lowest risk is in virtual only classes. The medium, more risk, but not high, is in small in-person. And we're thinking on the hybrid schedule, 10 to 12 to 13 individuals spaced out in a classroom. And then the highest risk is to bring everybody back and have our full in-person classes. We will continue to keep our eyes on the unanswered questions. We hope we get some answers before too far into the fall. But what will be the nature of transmission, Ms. Osinski? What will be the nature of transmission over fall? What will our infection rates and risks look like? And what is transmission like among students and staff? I do understand that last week, the headline was that Ann Arbor Public Schools will resume virtually. We understand that. That's the lead. That's absolutely understandable. But we wanted to share this roadmap this evening so that parents understand that we have every intention and we have a plan developed and coming into place to move along this path with our students who select the Classroom Connect option. We'll talk more about that in a minute. We will begin September the 8th in a fully virtual setting. When the data supports it, you can see the arrow and the schoolhouse are in the same square. There are a hexagon there in the middle. That's the hybrid model where we would introduce small groups and we would have them come to school for part of the week and be on virtual for part of the week so that the teacher and the students are able to remain in those small We're calling them home-based groups, cohort groups. So that is the middle phase. And don't we all have our eyes set toward that day when we can be fully in person again? Again, we're not putting any dates on this, but we're reiterating this is our intention and this is our plan for the 2021 school year. I do want to note the footnote at the bottom. Remember, virtual programming, and that's A2 Student Link or A2 Virtual. Those will be available all year long. We also want to reiterate that if folks choose the Classroom Connect, say we get ready to invite students back, if parents or families are not quite ready for whatever reason, they can continue to engage virtually. That's no problem. They can continue to do that. We planned ahead for it. So I think everyone remembers, but we'll just touch base, and we are refining these descriptions every day. But the A2 Student Link, parents and students that choose that option, it's fully virtual, and it's for a group of students who intend to be virtual for the entire year, or at least for the semester. In A2 Student Link, the student is a member. The classroom is the same exact quality instruction and curricula and programs every day that we have in our other programs, and yet it is a fully virtual engagement. Now, we do our best, just like we do in Rec and Ed, to group students from the same schools together here in the A2 Student Link. But we also know that it's a fully virtual environment, so students may be mixed if there aren't enough students at their grade level to have a full classroom at the one school. A2 Classroom Connect is that path where students and families understand that they'll begin virtually, but they have every intention of returning to school. And they'll be looking forward to rejoining their class at school, and they understand that the progression is fully virtual to hybrid to fully face-to-face. Well, we've heard from lots of parents over the previous week, some parents not wanting so much interactive, real-time, synchronous instruction. We've heard from parents saying, we really liked how it was last spring that my child and I could talk about the learning and do the learning at our kitchen table. We really don't want to be on the computer and plugged into a real-time classroom. So I do want to share that the A2 virtual trustees will be bringing that forward in our August meetings. We will extend that to middle school and all the way down to kindergarten. That is an independent learning approach. So we will ask elementary parents to work with their principal just to clarify exactly how that looks and to make sure that we're all clear on how that independent learning can look at the elementary level. Okay, we'll move on to our supports. Trustees, we've heard a lot about this next piece, and I want to tease this out more. As you mentioned, Trustee Basket, we are already reaching out through members of our team with all of our community centers, our community partners. Ann Arbor is an amazing town, and we have lots and lots of partners. And we'll be working to create a network of small groups of students to ensure the learning supports continue from day one of school this year. So these will be very small groups to keep with our health and safety, 6 students and perhaps 2 adults. They will be out into the neighborhoods as close to our students as we can get them. We read we're reading across media about how students of means are, ending up with their own teachers, with their own support people. We're really working to create that kind of setting for our students who are at most risk and have the most need. So what this would look like is a safe space for students to be able to engage in their virtual learning and also to have lots of wraparound supports. All of our community network is doing a beautiful job. I just want to give one shout out, and forgive me all the others because everybody's doing a great job, but I want to give one shout out to Bonnie Billups at Peace Neighborhood because we're actually doing this Connect Plus group over at Peace right now for summer learning. So we've been doing this and we will expand this network. Students will be able to get help with their virtual connection, any of their technology, their social, emotional, mental health, food and nutrition, you name it, we'll be plugging it in to these very small groups out there. We will be using some criteria that we use all the time in the district, criteria around our Head Start identification, Title I, English as a second language, homeless status. We will also be identifying with parents, social workers, our homeless liaison, Alicia will be helping us, teacher referral. We have a tremendous team, all of us together, to make sure we're getting the students who need this into their Connect Plus group. I also want to be clear, and Dr. Kellstrom will share with all of us more on this at another time, but we will be able to see in Schoology exactly who's not engaging. So just like under the watchful eye of a teacher in every classroom, our teachers will be watching, and we will also have the data, as the kids say, we will have the receipts to know who might not be participating, and we'll be plugging them into groups as we move forward. So this Connect Plus Learning Network is a community endeavor, and we're going to staff it. Trustees, I already have staff members writing me saying, I want to be in one of those, I want to support, I want to help. Of course, we'll use folks who have good health and will follow all of their safety and distancing protocols while they're in their groups, but we're excited to do this. If our infection rates pull us out of phase 4 or to any level that causes us concern, these groups will continue in a virtual setting. And we have many of these groups right now going on this summer. Ms. Parks can share more of our professionals who are with small groups of students virtually, helping them to do their summer adventure learning work. So this is a little bit of our support plan. I want to talk a little bit more, touch on our specialized supports, our students with special needs. This is about the provision of specialized services. There's synchronous instruction. That first half of the class is the teacher-directed time. That second part of each of the learning blocks each day, that teacher consultant, the para-educators, they are all pushing in. I had a great email from a para-educator the other day sharing how she and her teacher this past spring did a beautiful tag team every class period, that she would get into those breakout rooms and work with small groups of students. I want to be clear that students will have direct tutoring available if they're falling behind, specialized support for IEPs, those Wednesday supports, social emotional, and then we will always be considering our students for the Connect Plus groups as those are needed. We're absolutely in those Connect Plus groups, I just want to touch on making sure that all of their supplies and materials are provided. At the materials pickup, students will get their math journals, their art supplies, everything that's needed for their learning at home. And remember, with our youngest students, they will be on the top of our list to migrate in. So let's look at just a possible potential. And trustees, over September and the beginning of October, we'll be talking more about this. Our job now is to launch with the very top quality virtual programming for everyone. And then our very next job is to begin to design the plan for entry into our buildings, hoping that that day comes sooner rather than later. Of course, we don't say when that is because none of us knows. But I want to point out that phase 1, as we're considering it, would be kinder, first, and second grade, and also those students who are most in need and most at risk. These would be in small groups so that we can monitor, use our health protocols, check the rates of infection, see how it goes if there is a case, and monitor the overall health data. Phase 2, sometime after we see that we're making progress. Phase 2 would be our upper L, 3rd, 4th, and 5th grade students. And then phase 3, we would have a plan in place to migrate our high school students. So we see that our Reimagine Learning Plan, if we're able to achieve a reduction in cases, is really about a great migration that potentially will occur once we see that depression of the rate of infection. I want to talk about acceleration. We're hearing a lot from parents that they really want to use this COVID time to see their students, their children accelerate and to try new things and new opportunities. Just want to remind that all of our rich programming, the accelerated classes, the advanced placement classes, the international baccalaureate, our world languages, we have more than any district I'm aware of. All of those opportunities continue during this time. We do have dual enrollment at area colleges and universities. We can help folks with that process. And we do have our resource classes available for our high schoolers, our partnership with Washtenaw Community College. We do know that that has required quite a few steps. And as part of our equity and opportunity plan, we want to make sure, and I know our counseling team will assist and make sure our students who need it most can get those acceleration opportunities, and all of our students have them available as well. I do want to touch on that all of our programs will still be in place. Mr. Tom Pachera is leading the Project Lead the Way team. They are busy redesigning curricula so that their units will really work in a virtual setting and realigning some other projects to later in the year. Trustee Kelly and I talked a little bit today about some of the specialized equipment that may need to be available, even for students at home, application software, etc. All of our quality program offerings will continue. So trustees, I thought we would just highlight a different area each week. And I got so excited today seeing an email from one of our performing arts teachers coming to me through Miss Bailey. We're having wonderful conversation about how to continue our performing and visual arts programming at a level that's beyond what anyone has, and I mean anyone. And trustees, we know our arts programming is widely known, but I want to talk about how it will look beginning in a virtual setting. Our teachers will continue to offer the instruction that they've always offered. They will be able to give feedback. Students are able to create and produce and respond to art, music, and theater. They use both asynchronous and synchronous learning. They use the breakout rooms that are available so that small groups can work on their activities as well. Our arts teachers are able to rehearse groups and to meet with groups. And I was very excited today to hear about the possibility of an app that plugs right into Schoology that allows musicians to rehearse and record music in real time to create a final product and to be able to perform. And I just want to give a shout out to our many arts teachers. They offered performances in March, April, May, June that were just amazing on a virtual setting. Not everybody maybe got to see all of those, but I want you to know that work continues, and I want to give a shout out to our specialized programs because they're going to make virtual work. Trustees, we've received a lot of feedback about the schedule, so I'm going to skip over that next slide. We're looking at Monday, Tuesday, Thursday, Friday, with Wednesday dedicated to exploration learning. That's still in place. But I want to talk about these themes quickly and then get on to your questions and to the remainder of our presentations this evening. Trustees, a lot of engagement from our parents, and you heard it in the commentary this evening, wanting to modify that learning day for younger students, and also some interest in modifying the learning day for middle level students. So I want you to know that our curricula and teaching team have already been thinking this week, and they're talking to each other, engaging and thinking about how to, we have some parents asking for a modified day, and then other parents who really want the full treatment. 8 a.m. to 3:30 p.m. They want the whole day. So our teams are already working on meeting both of those requirements. I was able to personally be in a meeting with MDE a little over a week ago, where we do understand that we can modify the day and still meet the requirements. So we will be sharing more on that. We heard from parents at elementary that want less synchronous activity, and so we are adding that A2 virtual for elementary, and we'll be sharing more detailed information about that. We heard a lot of activity from our parents around give us a full day, but let the afternoon be more choice activities. Maybe the morning more directive. So we are working on all of those patterns. We heard from parents saying, could you get the lunch aligned? Because I need that high schooler to get the sandwich ready for the elementary one. And we absolutely are going to get those details ironed out. We can do that, and we want, as we've said from the beginning, we want to meet our students and parents exactly where they are. So here are our next steps. We will be sharing weekly. We shared last Monday, and we'll be sharing toward the beginning, Monday or Tuesday of each week, a new set of frequently asked questions and our answers as we know them. We will be sharing that at the beginning of every week over the coming weeks. We will be putting out opportunities for our parents to participate in school level community engagement by grade level, because we know those needs and ideas and thoughts are specific to the grade level. And we will also be sharing a district level opportunity for parents to weigh in and give us feedback. We will be asking our parents to make a decision around the middle of August. We introduced these options a week ago. We know that 3 weeks is not a ton of time, but we also know that we will be helping our parents, and we would like to begin enrolling in scheduling, assigning classes so that we're fully ready on September the 8th. The last thing we want to point to in every one of our conversations, trustees, I know you say it also, is that so much of this situation is beyond our control. Go ahead, Ms. Leszczynski, if you would. So much of this situation is beyond our control. And yet what we each do have control over every day is that if we leave our home or we're around people who are not part of our own family unit at home, we need to wear a mask, watch our distance, and wash our hands. That is key and critical for all of us. We can't control so much of the situation we're in, but we can control our personal behavior. The efficacy of mask wearing so far appears to be one of the most effective techniques to reduce the rate of transmission. Trustees, if it's okay, I've asked Ms. Bacalor to let our parents understand in our community what will happen if a case is identified. We know that a lot of our parents want to better understand what will the school day be like, what will happen in my child's class if a case comes up. And so Ms. Bacalor is joining us to help all of us to begin to understand what that process will look like. And then we will, that will put us to about an hour. President Johnson will be ready to pause and have discussion, if that's all right. Ms. Bacalor.
Good evening, Dr. Swift and trustees and the Ann Arbor community. I'm really happy to speak to this issue because I know it's been on a lot of people's minds, especially since the presentation last week. I want to echo what Dr. Swift said about our eagerness to get back to in-person school. This is really important. So we're doing the work behind the scenes right now to prepare for that. And one of the ways that we're doing that is preparing for when we have cases in school. We actually realized in the early summer that we needed to build our internal capacity as a district to be able to rapidly respond to cases. And then we're happy to see that that also appeared in the governor's Return to Learning Plan that came out June 30th. And that calls for school districts to cooperate with their local health departments to better identify cases and find contacts within school districts. So we know to best protect the health of students and staff, we need to rapidly respond. A little bit later tonight, Mr. Komsa and Ms. Lankford will be sharing some more specifics about our responsibilities as a school district. But I can tell you a little bit about the why and the how. Our goal is to intervene very quickly as we can, to make sure that other people who might have been exposed to a person who has tested positive are staying away from school campuses. So, and I gave the example last week in the health presentation about what happens if a teacher is infected and the contacts that staff person had. We want to be able to quickly make sure that people who are identified by us as close contacts are staying away from the school campus and getting help that they need. So the way that we're doing that, as Dr. Swift mentioned, is that we have formed a COVID-19 rapid response team so that we can quickly take action when a positive case is identified. This team includes district, and it will include some building leadership, and really some investment in the idea of having a health specialist right internally on staff who can rapidly respond. So the health specialist will be working closely with the county health department to do a sort of light version, I guess I'm saying, of contact tracing. And when we hear from an employee that they have tested positive, we will interview them. The health specialist will interview them, determine who those close contacts were in AAPS school buildings and campuses. We are not concerned with other contacts that person might have had that don't have to do with AAPS. That is for the health department to work on. And then we actually go ahead and notify the close contacts about their exposure and provide them with information about staying home from school or staying home from work. And this is not giving the local health department's official quarantine order. That's not our job. We're providing the information, and then we're connecting with the local health department, and they issue that order. So another really important part is providing support to our staff and resources to staff who are testing positive. So we've had experience doing that. We have 2 cases among AAPS staff people, and we have done this process and learned from it. The health specialists are going to and have started receiving really extensive training on how to do this. And of course, we'll be following all of the relevant laws and regulations about confidentiality. They will not be ever sharing names. And so we're following all of that very carefully, and it will be a relatively small team of people who are charged with doing this rapid response. We feel that this is a step that we can take as a school district to prevent the spread in our schools. And we have other ways that we're preventing spread as well. And if you are interested to see more ways that we're preparing, there is a new document that, Amy, you could share right now if you want to, that goes over more of a family Q&A about how is the school district preparing to go back to school and protect students at the same time. So just to assure people that we are working hard on developing these protocols. Again, Mr. Comsa and Ms. Langford will be going over this in a later presentation, so I'm just touching on it briefly now. Thanks.
Ms. Beckler, would you cover, though, if a student or a teacher in a particular cohort group tests positive, what might that look like? Because I know that's a component that our families are listening for in order to kind of think about which program they're choosing for this year. So would you comment on that? Sure.
That will... If a staff person or family member or a student tests positive, we have a couple different pathways for what happens. For a staff person, they will call us right away, and then we will quickly do that interview, which we've done this twice so far, and determine who were their close contacts during their infectious period, which I went over last week in my presentation, and then provide them with what we think is going to happen, and which is quarantining. If they're a close contact, that means staying home for 14 days. If they're a student, they can switch over to virtual at that point. And we want to make sure they're okay. We want to be checking in and seeing, do you have what you need to be home for 14 days? And the health department then kind of swoops in. We kind of tag team with them, and they provide actually frequent nurse check-ins with people who are on quarantine or who have tested positive and are isolating at home. So I think we have a great partnership set up with them that will meet our staff needs. And for students and families, it's a little different because, of course, we really encourage and hope that people will call the health specialist line and let us know so we can do that exact process with the family, with the student, and try to understand who might have been in close contact. And again, we are really focusing on AAPS school buildings and campuses. We're not looking at broader than that. That is not our purview. And so, but we're trying to prevent the spread on our campuses as much as we can.
So not to put you on the spot, but if it's in the little cohort group, say we're on a hybrid status, it's in the little cohort group, 10, 12, 13 people in the room, and there is a positive case. This is the question every public health official is getting asked right now. Would it be the infected student who remains home for 14 days? Would it be the entire cohort group that remains home for this 14 days? Would it be the grade level? Would it be the school? I know that there are many variables, but generally, can you give folks a flavor for how that would look?
Sure. If we are able to really keep children, and I guess, are we talking elementary right now?
Elementary, yes.
That's kind of where my brain is right now.
Yes.
If we're able to keep elementary children really in those small groups, it's and not interacting with others throughout the day, it's possible for us just to quarantine that classroom. And we would, of course, be speaking with the health department to get specific guidance around that. But that is one of our strategies to not perhaps to have to close the whole school. If we're really keeping kids in their little bubble together, we have to work out more on what this will look like. But that's why it's good we're building in this flexibility to switch over to online if we have to.
Thank you. President Johnson, that completes our clarification and update on the Reimagine Learning Plan, and we'll be happy to receive any questions.
Thank you very much, Dr. Swift and Ms. Backlor. We have a question already. Jessica, Trustee Kelly.
Thank you. I'm sure that there's just more questions around what that looks like if there's a positive case. So I have a couple clarifications to what you said, and then maybe some broader questions. So you said if there's a student who tests positive, then it's the same call, interview, figure out who they were in contact with, and then you said then the student can switch to virtual, but you didn't mean switch to link. You meant stay in their Connect group, but switch to the virtual access of Connect for 14 days. Is that accurate? Yeah. Okay.
I think so, yes.
Okay. And then if that student was part of, say, a 10-person cohort that we're confident was not intermingling with other 10-person cohorts, the entire 10-person cohort will switch to all virtual for 2 weeks, or they will continue to go to their classroom but really strictly stay by themselves and kind of quarantine together? Which is that?
Yeah, I think, so, people in public health always say it depends. So I'll just say it depends just to get that out of the way. But it really does depend. But the most likely thing is that they would be staying home for 14 days because we would, if they have had a classroom exposure, and in our younger grades especially, we're not requiring masks. So if they've had a classroom exposure, we really would want them to stay home. Again, we're still we're going to learn as we go. We just want our top thing is to try to prevent the spread from going elsewhere in the school building.
Right. Well, and a lot of students have siblings. So if a student is home because they have a positive test, we've done our contact tracing, will the siblings from other grades then be home too?
Boy, you're asking some really hard questions right now.
I know it depends. I really do. But I think that's kind of the calculation families are thinking about as they go to select their choices. And I just want folks to know that we're asking the questions, even if we don't necessarily have all the details worked out.
And so in my conversations with the health department and the research I've been doing, that is such this crucial gray area, because typically a contact of a contact, we are not worried about yet. But if they are in the same household of a close contact, that is the thing that we just need a little bit more guidance on that. And what would that look like?
Ms. Backlor, the sibling of the infected child would definitely be quarantined.
Absolutely, yes.
But if the question was about the siblings of other children in the group, you're saying that's the gray area.
It's the siblings of exposed children who have not tested positive, they're not showing symptoms, they're living in the same house. What do we do about them? Some people will say, send them to school. Some people will say, absolutely not, do not send them to school. So we have to navigate that line. And maybe it's, stay home for a certain period. Again, all of this would be better if we had rapid testing available for free to everybody, because we have to do so much guesswork on level of risk and everything. And so let's just hope that that comes soon, and that will really help us out.
Okay. And so then a student or a staff member in a 10-person cohort tests positive, we inform just like the strep letter goes home, right? Will families get an email the way they get when there's a case of strep throat, or will they get like a robocall like it's a snow day? How will families learn that quick, make childcare plans, change your meetings to next week because you're staying home now?
Yeah. I mean, what we have done so far is actually call people to be able to answer questions and help people through it. That's why we need, very skilled people to be these health specialists who can be both informative and compassionate, and connect people to resources as needed. So for anyone who's a close contact, my preference would be, unless we have a huge outbreak and it's not possible, is that we actually call people for that broader communication of, okay, there was a case in your school. We would do that by email or robocall, just so people are aware. We don't want to scare people, but it's just, people want to be aware, right? People want to know, even if they are not at increased risk.
Absolutely. Thank you. We know that a significant portion of people have no symptoms. So if you get the letter, your classmate tested positive and you were exposed, and so now you know that you're maybe at risk, are we just saying if it's, depending on the class, right? We don't know if everybody's going home or not, but is there going to be any kind of entrance requirement to get back to school? So, and for two groups, right? The people who are definitely exposed, but maybe asymptomatic, we want to make sure that they're going back and keeping the people around them safe, but also the people who tested positive and maybe falling into this class of these long haulers where 2 weeks may not be enough time for them to not be sharing what they've got. How do people get the okay to go back to school?
Yeah, that's a great question. And I actually talked to one of our people who's been on quarantine this morning and worked through that process and worked through with our recent case that we do. The returning to work or school is dependent on people being symptom-free, including fever-free, for at least 3 days, and that is included in a bigger 10-day period. So there's this infectious period of 10 days. So 10 days is the soonest you can be released from that isolation if you've tested positive, but it could be longer if you're having those symptoms. And that's where we really depend on our partnership with Washtenaw County Health Department. So for example, this recent case that we've had was really to come back to work. And so the health department provided a letter for return to work. So we're working out those processes right now with the health department and our fellow school districts around the county for how that'll work. For quarantine, it's a little different because there's a 14-day time period from the time of exposure onward. So somebody who's a close contact might end up having to stay away a couple days longer than the person who was actually infected, which is a strange thing, but it's just how we're dealing with it. And in fact, this most recent case that I talked about this morning, the close contact is still in quarantine, even though the case has been released to go back to work. For the close contact in quarantine right now for a couple more days. So
sure, because you described last week how there was like the incubation and then the extended time. So your graphic last week helped us understand where you're going with that. I'm sorry, I think I cut you off.
No, I was done. Thanks.
One last question that may have to be a team effort. And I know there are so many more questions about health stuff, but I just wanted to kind of get those like basics, just, parents have a framework of getting the strep throat letter, so I just kind of wanted to put it into that framework. But one more question that may be sort of a team effort to help understand is, we've talked about technology for kids, and we've talked about, the handwriting books and all the manipulatives that they'll receive in our first week of getting set up. Because access to the buildings could change so quickly in the event of a positive case, will children be traveling with all of their stuff every day? Will they have their computer every day back and forth? Will they have all of their books every day back and forth?
It is. I love that question, and thank you. It is our hope that the technology device that every child's receiving, and the trustees have been so supportive, and Dr. Kellstrom is bringing an order this evening, that device, we believe, would remain at home.
Okay.
But it is one of those areas we're still sorting out. But it would be our desire, let me qualify that, especially at elementary. It would be our desire that the students not have to bring the devices back and forth.
Okay. And of course the winter's a little tricky because now you've got snow pants and snow boots. And I heard more than one case of a child who left snow boots behind in March and outgrew them before they were able to retrieve them. So, last week we mentioned a little bit about, this is terrible. Nobody wanted this situation, but I think there's a real chance for families to think about how complicated in-person schooling might end up being with the uncertainty and the unpredictability and the day-to-day of just being ready on a moment's notice to school anywhere. And so I really hope people are thinking carefully about their options, and if they don't have much tolerance for that kind of agility, that they do explore the options for the stable virtual option for the first semester. Some families are very agile. I don't purport to tell anybody what to do, but for families who recognize that they themselves aren't as agile, I do hope that they explore all of their ways to keep stability by choosing the link option, which leads me to one question I had from the earlier presentation, but I'm not sure if we're only doing health now, or can I ask something from earlier?
Yeah, anything, we're ready.
Oh, okay. This is my last question. I'm hearing a lot of folks saying that they want to choose Connect because they really feel strongly about staying with their classmates, their community, their teachers, but reminding one another, and this is the clarification piece, reminding one another, but remember, you don't have to go to the building. You can just stay online in the Connect option. So it almost appears as though families are trying to create sort of a hybrid within a hybrid where they want the link virtual experience all semester, but they want to do it with their classroom and their teachers. Is that what we're equipped to do, or are we relying on families who choose Connect to commit to going to the buildings when it's feasible?
We thank you for that question. We're very fine for students to choose, families to choose Classroom Connect and remain virtual. We're very good with that. The reason for A2 Student Link is we have a fair number of families saying, for whatever reason, and they have many differing reasons, we will not return until there's a vaccine. We just will not. So they're looking at a way for their child to participate with other students who are not heading back to school. And so the key distinction, same curricula, same awesome Ann Arbor Public Schools teachers and curricula on both, but one, the child is a member of a fully virtual community, classroom community. And that child in that one may be connected to grade school folk they know, because we're going to try to keep them as close to their school as we can. But in the Classroom Connect, if folks think they're going to be virtual all year, again, like you, Trustee, I'm not proposing to tell them what to do at all. This is far too complicated. But at some point, the child might be looking into the classroom with other colleague students inside the classroom.
And have we explored what kind of, I guess I did have one more question, I'm sorry. Have we explored what kind of microphone or linking the sound systems that the teachers use to Bluetooth to their computer? Have we explored ways to ensure that the instruction that the teacher is then doing in a classroom to a small group is as high of quality in terms of audio and visual to the students who are at home as it would be when everyone's at their own, like, you know, climate controlled situation when they're all virtual?
That's a great question, and I know Dr. Kellstrom's coming next to help us with Schoology, and I know she will address that, but we are looking at the how to ensure that sound, light, action, everything is consistent, you know, whether they're piped into the school or whether they're connected to a teacher who's somewhere else.
Okay, I will listen carefully during that presentation. Thank you.
Thank you.
Thank you. Trustee Beskat.
Thank you. First of all, Dr. Swift, and to the team, you guys did an awesome job in putting all of that information on paper. I feel like I can almost walk through this with any concerned citizen. So thank you for making it graphically, visually, just very easy to follow, so to speak. Ms. Bacalor, since you have been speaking for a while, let me address some questions, please, to Dr. Swift, and then I'll come back to the health. So first of all, Dr. Swift, we have said that parents need to indicate their preference as soon as possible by mid-August. How are they to indicate that preference?
Well, Trustee Beskat, thank you for that question. We are working on the interface because we want our principals to be able to have that data immediately so they can start figuring out teacher assignments and classroom lists. So we will be sending that email out next week, and we've narrowed it down to about 2 or 3 interfaces that might work. We want to make sure that it's fully functional. We don't want to misfire. So Mr. Cluley and members of our team are deep, our ITD team are deep into that.
So for families who may not have heard from the district by end of next week, they should reach out to whom?
We will want them to give their principal a call, and that, say August, I'm going to look at the calendar, but by the end of next week, And I'm just
So they
looking.
should call their school. If they
Their
have
school.
a school right now, they should call that particular school.
It's always best right now to email if possible.
If possible.
But if not possible, then yes, we will. A phone call is great.
So I just want to stress to the community, we will make the initial email, but we know email addresses change.
Yes.
Or expire or whatever. But if a parent hasn't heard or a caregiver has not heard from us by the end of week, they should take the initiative and at least try to contact their principal. For students who are getting through schools of choice, say new or even new students, this is their first year with us, whether it be kindergarten or transfer or whatever. Same thing applies. I'm sure we've already notified them which school they've been assigned to. And so again, same thing would apply. They should reach out to their school that they're expecting to attend.
As you're right, Trustee Basket, as usual, we are continuing to finalize those in-district transfer assignments right now. This is the time of the summer where we ask everyone, are you really coming? Because folks do move over the summer. So that process is still settling. But yes, we will be in touch through email if folks have not heard. And then, just like every fall, if we don't hear from folks, we will be calling them before too much longer, because that's just what we do every August.
Yeah, but to make it easier, and again, for planning purposes, the sooner the better, folks. Right?
Thank you.
No, and so transitioning a little to the health issue, how are folks to communicate a probable case of the virus? You mentioned, Ms. Bacalor, a health care line or contact line. Is this line available, say, Friday night or Saturday morning? I know sooner is usually better for us to know, especially when it comes to contacting, but tell us what is possible.
Yeah, so far it's been my personal cell phone.
Bless your heart.
So, it's my work cell phone. But we have to work that out, and I need to consult a little bit with Ms. Kellstrom about how to set up that line. As Mr. Comsa will talk about during his presentation, the executive order that is for employers requires employers to do that whole process within 24 hours. So our first case came in at Saturday at 2 p.m. and we did all of the work by Sunday at 2 p.m. Wow. So we were bound as an employer to be that fast. That same time restriction does not apply to family. And this actually has been an issue over many years for different illnesses that we see in the school district. So people want to know, for example, who was that strep case? Who was the pertussis case? So we do have a track record of handling those kind of conversations, and we may not share names. We just absolutely may not. And so part of that conversation with people is assuring them this is completely confidential, and we are just gathering this information. When we call the contacts, we say, you have been identified as someone who is a close contact of a positive case. We keep it super general. So far, I've actually had really good conversations with people. I think it's harder when it's, I don't know, we're going to try to keep this really AAPS friendly. I think it's harder if it's somebody in a different community or different setting, but we're trying to keep this like we all have a shared responsibility. We are taking care of each other. Part of taking care of each other is providing this information. So let's work together.
And I think it would be very helpful if community members, i.e. parents, caregivers, stress that with our young people as well, is we need to know as soon as possible if there was a transgression. We all know kids break curfews and break rules, but this is very serious. They could save a life potentially. So I'm going to ask our parents in advance, have that conversation with your young people. It's never too soon to stress honesty, especially when it comes to health, because it's just a needed thing for the whole community. Thank you so much.
Thank you. Trustee Nelson?
To Dr. Swift, on the slide where you described the phases that we hope to get to before too long, where the youngest grade is moved face-to-face, and then if that goes well, the next tier goes face-to-face. Is my understanding right from other portions of your presentation, in all cases, those who move are volunteers to move, that if we would begin that phase one for pre-K, K, and I forget, 1 and 2, that if some of those parents preferred to stay in virtual, that will still remain as an option, so that as we develop face-to-face, those moving to face-to-face will be doing it because they wish to. Is that correct?
That is correct, and that was an important part of the design for us. So many are offering just one setting or the other setting, but we felt strongly that Classroom Connect needed to leave the choice with the parent.
We may want to get that information into that slide.
Okay.
I know it is elsewhere, but it never hurts to re-emphasize an important point. That's my only question. Thank you. Thank you to all of the team for all the good work.
Thank you.
Thank you, Trustee Nelson. Trustee Lazarus?
Thank you, President Johnson. Thank you guys for putting this together. I know this is not an easy situation, and it's definitely not where we want to be for the fall. But I have a few questions, and to go off of Trustee Nelson's question about slide number 26, when you say that the kinder through second will be the first to merge in, would that be in a hybrid? We go from a virtual to a hybrid. We would test that out in a hybrid situation first?
Yes.
Okay.
So we would go from virtual to hybrid, and we would monitor that before we would consider a full.
So would we say, okay, we did the hybrid, we monitored it for a while, everything went well. Are we going to then go kinder through second full face-to-face at that point before we bring in phase 2, the third and?
No, we would. It depends on the public health situation, but the idea is that we would phase in our grades into a hybrid situation. That likely would be where we might need to sit for a while, because really would be representative of a different phase, like a phase 5, or a phase 6 before we could be. Because what we give up when we go full is we lose the social distance.
Right.
So we would have to be to an overall readiness in our community to no longer have the social distance. Okay. So you're absolutely correct. It would be from virtual to hybrid. That is the migration we're talking about.
Okay. And then the other question that I have about, I had a question about the phone number, but you dealt with that one. The other question, it falls along on August 12th. I know we're going into this virtual world of learning, but I have been approached by some parents that, are we reaching out to parents to make this decision other than email? Because emails get lost. I mean, they get all kinds of stuff, and they may end up in the junk mail or whatever, and they may not see it. Is there any other way that we're reaching out to parents to get their choices and help them? They may not sit through a 5-hour board meeting or even want to go to a website. Where can parents that don't really embrace technology get this information and understand it?
Thank you. Just like we always do in the district with everything we undertake, our people will be in personal contact. We know those students, we know them very well through their counselors, through their social workers, through their grade level teachers, through their principals. We will reach out to every family that we do not hear from. And this is our normal. This is no different for this decision than it is for other things that we do in the district, is we put a full court press on our outreach. We reach out to our community centers. We reach out in every direction so that we have, for example, our teachers of students with special needs, with the IEPs, we will be contacting to ensure that folks are comfortable with their setting, their placement, that they know and they're in agreement. We won't wait for folks to contact us. We never do on any of our class placements. We were always working on that.
Will we be doing any mailings explaining these choices to parents?
We have a mailing set to go out here in a day or two. It's all ready with exactly the information you've seen this evening. It's not just going to our known students, it's going to every household in the community, because we want to make sure that everyone knows.
Perfect, great. I do have a question about the what if scenario if there is a case reported. On the return back, or let me start with this question. You mentioned elementary would be handled a certain way. How would, if we're in a hybrid situation, how would a middle school and high school, how would that differ? Or would it not differ in any way?
So, Ms. Bacalor, if it's okay, I'll start. We will be fleshing out those details at secondary. I just want to point out to the community that it will be much more challenging to maintain a small cohort in a secondary setting. Mm-hmm. So the fundamental difference is that on a 3-class period day, the student may be exposed to a few more people. Mm-hmm. The other difference, though, is that our secondary students are required to wear masks. So there's one area where it'll be a little more complicated, and another area that causes us some relief is our secondary students will all be wearing masks. So with those things stated, Ms. Bacalor, what in the world will you do at secondary?
I think because of the mask wearing, the risk of transmission is a little bit lower, of course. It really becomes a scale problem of how do we investigate and notify. So our ways of doing that have to be modified a bit to accommodate, and it may take us longer to reach everybody. And this is another area that we need to get more help from the health department on how to manage that initial case investigation and contact tracing that we would do is just much harder. So how to manage that is something we need to work out with them.
Okay. So let's say we've gone through the person is symptom-free for the 10 days. And the question is, in order for them to re-enter the school buildings, are we going to require, hopefully by that time, we may have rapid testing available to us. Would we implement that they have to, like how these baseball players have to go through 2 tests, negative tests in 2 different times in order to re-enter into the playing field situation? Would we do something like that to be sure they're symptom-free?
You're muted, Jenna.
Sorry. Unfortunately, that is not a feasible step for us to take. Those pro sports teams probably have dedicated labs, and they're able to do that kind of surveillance type testing. That's how we keep getting these positive tests, even if they're asymptomatic. They're testing frequently. So at this point, there isn't any guidance for us that says we have to have those 2 negative tests. It would take forever to get them back anyway. So although that's not a feasible option right now, it may be in the future.
Right. And just one other question regarding the tests. So if we are notified that someone is positive, they've obviously gone out and had their own test. So would we require other than just calling and letting the other people know that they've been exposed, and do we just recommend that they should go get a test also, have a test done? We don't do it for them.
Correct. If we have there might be an exception that Mr. Comsa will speak to about if an employee becomes ill during school, we might be able to pay, they could go to the district clinic and get a test in that scenario. That's that would be a rare thing, I think. So we have like our kind of notification that we can do, but really some of that getting a test or not is up to the person in consultation with their doctor and the health department. And those kind of orders to get a test wouldn't normally fall to us, especially for community members and students. That would be, at least at this point, that's kind of an optional thing they can do. And again, if they're going to a location, and I'm not going to name names, but like a drugstore location for a drive-through, it could take them 2 to 3 weeks. Like right now, it might take them 2 to 3 weeks to even get their test back. So we can't mandate it right now, is what I'm saying.
Okay. All right. Thank you very much.
Thanks, Trustee Lazarus. Trustee Gaines.
Thank you. Dr. Swift, thank you for leading off the presentation tonight with sharing our district's concern for equity, for awareness of underserved communities. I appreciate your response to Trustee Lazarus about making sure families are contacted who need to be contacted. When we start up again, of course, we'll continue to have the issues of students who are less engaged than we would like. And we're also going to see the disparities in performance as we always do. Given the virtual setting, what assessments are we going to be looking for? And who specifically on staff is responsible for contacting and supporting families?
So, Trustee Gaynor, I really appreciate the question, and that would be the assessments that would tell us how students are progressing.
Right.
Okay, so I know just generally, and we will focus on this more when Ms. Linden wraps back around to us to give us more in-depth on the plan, but I know that teachers are generally looking this fall at formative assessments inside the lessons they're doing to see where the gaps are, how children have done over the intervening months, but we will be more specific on that. Just like always, even when we're face-to-face, that follow-up occurs across the school team. So it's the school teacher. If the student has an IEP, it's the teacher consultant. It's the social worker, it's the principal, it may be the counselor. There's a full court press to get that student re-engaged. I know you're familiar, but I'll just share it for the community. An Achieve team process ensues to do some root cause analysis to determine, what's going on and what additional supports are needed to help bring the student up to level. So those processes will continue, and I would love to be back with you on the specific assessments that we'll be using this fall.
Okay, but we have a procedure to make sure people aren't falling through the gaps.
Absolutely. And we were using that. We always use it face-to-face, and we were actually using it last spring. I even had, it worried me a little bit in the health and safety realm, but we even had intervention specialists and counselors who were keeping their safe distance, but out knocking on doors of students who were not responding or not engaging at the level. So we make calls to our partners. We take every step that we possibly can to ensure people are engaged. Our students are engaged.
Thank you. We were all scrambling last spring, of course, and there was concern expressed by the community, and I know concern that the district shared about services for students with IEPs and other special needs. Can you give us an update on how things have progressed through the summer and the outlook for the fall?
So the good news is that our teachers and special service providers have learned the tech systems to be able to deliver in a tech-based setting. We're not pretending by any means that that's perfect or seamless. There are situations where the child may have needs such that delivering on a virtual setting is extremely difficult. So again, as we move through these weeks, I know one of these weeks we will shine the spotlight on students with special needs, and I'll have you hear directly from Dr. Fedician. But I would say that 450 of our students with special needs have received services over this summer and extended school year, et cetera. And that process is moving right along. Some parents have shared with me that they actually prefer, in some ways, the individual attention that they're receiving in that kind of setting. Now, granted, it's not that way in every case, of course. Yeah.
Thank you. And jumping topics a little bit, any updates on sports activities for the fall?
Well, there is an update from this evening, and I believe we've got Ms. Parks and Mr. DeAngelis with us this evening. I do want to reiterate before they speak, the final decision on sports and activities rests with our Ann Arbor Public Schools leadership team under the guidance of Ms. Bacalor and the health department. So just because the MHSAA makes an announcement, I just want to clarify to the community that does not mean that will be our approach in the district. So I'll have these folks share the update and then hold the phone, because we'll be providing more guidance as we move forward on this constantly evolving topic. Ms. Parks, Mr. DeAngelis, do either of you want to share?
Good evening.
Mm-hmm.
I can do a brief update. The representative council of the MHSAA met today as planned, and they released a statement very quickly. Some of us thought that it would take a couple of days, but they did give us a statement approving a plan to phase in their fall sports. So they've looked at this in terms of low risk and high risk activities. So this is just a quick, brief summary of the plan. Girls golf, boys tennis, cross country, and girls swimming and diving will begin practice as scheduled on August 12th. However, we are currently still in phase 4 of the governor's plan, and indoor practices can still not be held. So even though girls swim and dive is scheduled to start on August 12th, until the governor changes her order, they would have to practice outdoors as they currently are now doing their training over the summer. For the higher risk sports, football, volleyball, boys soccer, this would include in Ann Arbor field hockey, although it's not an MHSAA sport. This could also include pom and cheerleading. Practices can begin, but they will not participate in any competitions at this point in time. The MHSAA will come out with another update probably closer to the middle of the month. So for football, volleyball, boys soccer, field hockey, it's going to look very much like it does now, where they can condition outdoors, practicing social distancing, and following all of our PPE requirements and guidelines. A decision on the competition timelines for these sports will be made on or around August 20th. So football, and this always gets a lot of interest, football was scheduled to start on August 10th. They are now not going to make any kind of announcements until August 20th. So I think it's safe for us to say that there certainly will be a delay with football, as well as volleyball, soccer, field hockey, and some of those other sports. The MHSAA has issued within their representative council statement today that there will be no scrimmages between teams. Again, this is just to limit the exposure of athletes from one school to another. So there'll be no scrimmages, which are typical during the month of August ahead of the season starting. The MHSAA has posted sport-by-sport guidance outlines, which increase the precautions designed to limit the spread. They've also issued some general guidance. This is very similar to what they've already put out there, but three main topics of that guidance include protocols for reporting COVID-19 infections. And of course, we would follow our own protocols if they're more stringent or if we deem them to be better. Guidance on face coverings. There is athletes on the field don't have to wear face coverings, but they can. But anybody who would be on a sideline or not participating would be required to be in a face covering. They'll also have guidance on the use of transportation to and from events, use of locker rooms, and again, indoor facilities right now are excluded from use, and as well as their recommendations around facility cleaning. The other piece of this will be whether or not we'll be allowed to have spectators. Again, the executive order from the governor doesn't allow us to have large gatherings right now, so a lot more to come from them, and a lot more to come from the governor on this, because it will be her executive orders that determine whether we could even have spectators in the stands or in gyms if we do end up starting the season. One thing of note that is related to Ann Arbor, because we have water polo. We're one of the few schools in the state that has boys water polo. This is a non-MHSAA sport, but their organization today made the decision to move that season from fall to spring. Just before we started the board meeting, I also saw that the state of Indiana is moving football to spring and a couple of other sports to spring. And I just have this sense that there's going to be continued talk, even though the MHSAA hasn't said so. I think there's going to be continued talk about changing some sports seasons. I want to reiterate what Dr. Swift said at the very beginning. We will make local decisions in the best interest of our student athletes and coaches. What is deemed to be the best measure we put in place of our student athletes and coaches. So even though the MHSAA has come out with their guidance today, we'll begin our planning as early as next week in preparation for what we believe is the what is the safest way to approach fall athletics.
Thank you.
All right. Thank you very much, Trustee Lightfoot.
Thank everybody so much. On the sports, I'm concerned about that. I just want to register my concern about sports. If we're not having in-person class, I do not understand how we're going to justify putting our young people in that space. I wish the men at the state level and other spaces would call it and quit playing games with this. And I'm just on record saying that. So I look forward to what our team comes up with, but I don't like it one bit. And I just want to say that the conditioning piece, if I had to wrap my brain around anything, possibly maybe, but that's it at best. So I just want to register that. Thank you so much to the team for all the work that you've done. I appreciate it. To the other trustees for the questions you've raised. I know our team does not have these answers yet. I know they are working feverishly to get them. And I appreciate the public sending in the amazing letters that they've sent in. Some are quite harsh. That's okay. I like to extract the constructive from the critique. There was a great deal of constructive things and questions and awesome ideas that I know our team are looking at pulling apart. We don't have all the answers again yet, but the community has really helped us ask some really important questions and think through some things. I hope that the community too is listening to even a piece of some of the things that we're saying. The reality of us just coming back, and I'm going to say it, I know everyone else, I'm going to say it. I want our parents to be more mindful of that reality. It is a huge undertaking to just flick the switch back on for schools, particularly when we're talking about the amount of contracting, outside contracting that goes on in any school district, not just ours. And then having those outside contractors build back up their capacity and what they need, getting those PPEs, getting enough in, getting them disposed of, getting more in, so that we're keeping up with that. All of those things, there's a lot of nuances. And what I want to be fair to our team, I know they have to have all the answers and all of that, but the reality is we need the team focused on making sure we have a seamless transition for the fall, and not so overly trying to come up with all these answers about the next phase. Not that we don't want them working on that and having the teams put their best minds to that. But the reality is we're going to meet cracks just doing what we're trying to do. And we're going to need them plugging those cracks, adjusting them, fixing them, helping our children, particularly our babies with the special needs, who don't fit any of the solutions that we put in place. We're going to have to be really making some specialized structures and situations so that we're keeping our children whole as we possibly can. So I just want to be fair. We have phase one to figure out. And I want us to get that right with our teachers. I want our teachers to have all the support they need. I want them to have all of the tech support they need, all of the assistance. I don't want our teachers having to do it all. I watch some of those videos and they make me laugh. I need to laugh sometimes in the work that we're doing. But to watch some of the stuff that those teachers have to go through online, just getting past the children not wanting to show all their pets before they could even just get to the work. So I appreciate our babies, but there's some work that our teachers are going to have support around. So I want us to make sure we're doing that. On Ms. Bacalore's piece, she talked about what the employees and employers have to do with each other. And I want to get clarity. So if we as employers have to provide 24-hour turnaround if we are notified that an employee has it, right? Is that correct? So then technically, I could see where we're rotating in and out teachers, even if not children, because if they're on 14 days quarantine as a teacher, we're having to move in some other staff to do that work, right? And one of the things I've talked to is I'm on these calls with state level other board members. They talk about the sub pool and how everyone will be pulling at this sub pool as we deal with potential cases as we come back in person. And so just what those numbers look like. The other piece I want to say, Dr. Swift, I appreciate you articulating. When we get to that place, the more clarity, the better. So I love the articulated version and the drawings, but I like it I don't like the word for dummies, but I love that series, Cooking for Dummies and Car Fixing for Dummies. But breaking it down for us, I appreciate the names, the connect this and all of that stuff, but the simplest way that we can convey that information. I also love the pictures. I appreciate that. I also appreciate one of the letters that Ms. Osinski wrote. They talked about the pros and cons. If we could we may not like that word, pros and cons, but whatever the benefits or the challenges might be for parents. So once we do settle on just making sure that we have a simplified version as we possibly can.
Thank you.
I did have the one question on what is the contact time if it's 24 hours for employees, employers. What is it for students? Have the county or the state shared what kind of time we need to notify parents?
There wasn't a time frame given in the governor's return to learning plan. It just says that we have to do it for students and as well as staff.
Yeah, that's interesting. Okay.
Yeah. So we know the faster we do it, the better.
Yeah. But I guess technically parents would be letting us know more than we would likely be reaching out to.
Yes.
That makes absolute sense. Okay. I look forward to us continue to work behind the scenes on some of these answers. Thank you so much.
Thank you, Trustee Kelly.
Thank you. I appreciate the second chance to ask questions after I had a minute to process what I learned earlier. One quick one. Typically, the guidelines for returning to school after an illness is 24 hours symptom-free. And it sounds like our guidelines for returning after COVID is longer than that, 3 days symptom-free, maybe longer depending on the situation. If a family doesn't have a positive test and we don't know why the child was feverish, why they were coughing, why they were vomiting, what protocol will we use if we don't have confirmation that it's COVID?
We will use our typical protocol that is preventing infectious disease in general in the school buildings. And actually, Keely Hoffman and I reviewed that last year and want to make some changes to it because parts of it are not clear. But this is another challenge that we'll face, that there are many other illnesses that children and adults can get. A lot of them involve fevers. A lot of them involve coughing. So we're going to have to, we'll have that same protocol that we always do, beefed up a little bit, I hope. And then also the COVID one is a little out of our control because that's the health department and public health guidance. So we're enforcing it basically.
Okay, so we can't force folks to go get swabbed. So we won't necessarily have confirmation or denial of a case. And so it sounds like everybody just needs to be ready to reread the guidelines for return to school after illness in general. And that's forthcoming.
Yeah, and I'm not going to say this is easy for parents. It's
sure.
Yeah.
Okay. Okay, thank you.
School nurses will be a great resource for this too.
Thanks. Trustee Basket.
Thank you, President Johnson. Thank you very much, colleagues, for the questions and the exchange, because it's brought up a few more questions for me. But I want to address first the subpool. If we are going virtual, at least for this semester, are we able, and maybe this is a Mr. Comsa and Ms. Langford question, are we able to pool subs nationally as long as they're accredited in Michigan?
We probably could, but because we anticipate that there could be greater levels of disruption than usual due to exactly what Ms. Bachelor and Trustee Kelly were just discussing, our team, along with our employee group partners, we're looking at some arrangements where people will be networked into teams all the time so that they can carry on the work. Our hope is to minimize the use of subs because once we're back in the building, it will be problematic to have a different individual in front of the children because you're trying to maintain that small cohort group. So I would ask the trustees if you could just hold that thought there is great intention in the design of this to try to get ourselves into partners and situations with building assigned subs full-time and just a variety of strategies that are on the table. We're still ironing it out, but we won't be using the sub lottery like we have in the past, and lottery is the wrong term, please forgive me, but the Rolodex, it won't be quite that way.
Sure, and I'm sure our benchmark of requirements will be a little higher or different than in the past. I know in the olden days, it was any live body that was brave enough to do a middle school math class, was the sub for the day. Of course, standards have changed, but again, I was just trying to be mindful of something that could be upon us, but thank you for reminding me about the team teaching approach. My second question is about the sports recommendation. If it's up to us ultimately anyway, and Dr. Swift, I know your team is tasked to the hilt already, but I look forward to hearing what Ms. Parks and Mr. DeAngelis has as a recommendation of sports. And I think the sooner the better for us to have that discussion and make that decision. I know Mr. DeAngelis said August 20th is the next perceived announcement from MHSAA. But my fear is they're just kicking the can down the road until someone else makes the decision and it's off of them. And if the decision's up to us, I would like to explore the opportunity of having that decision-making process sooner rather than later. Then kind of leading to that, I was thinking, what is homecoming without a homecoming football game? But homecoming may be different this year for a whole lot of reasons. So I'd like to encourage, and again, I know the team is stretched and tasked the hilt, but principals are probably already doing this. What does the school year look like? How different will it be? Will PTO meetings still continue? Will there be on Zoom? But will the pumpkin sale happen? Probably not. But the bigger things like homecoming activities that, we used to do in high school, I think they still do some of that. Are there other things that we have to be mindful and probably prepare the community that things will be a little different this year? So thank you.
Thank you, Trustee.
Thank you so much, trustees. I had a couple of questions, but I think I know that we will hear more about this plan going forward, so I'll reserve those for later. What I did want to do is commend the team because I don't know if those watching feel the same way that I do as I listen to all of the details. This is a Herculean task that we're undergoing in real time with a real deadline. And one thing that I think about is districts that have promised something different. They have to think about all these things as well. And to what extent, one thing that I do like about this plan is that we're not in the business of a bait and switch at all. We're being very realistic about what's happening. We're thinking about the possible disruptions to our students' learning. And then also just kind of this idea that we're starting at a state that even if we go virtual, we may have to return to. So we're building some muscle memory early on. And so thanks to the team for really thinking those things through. My hope is, and I think Trustee Lightfoot was touching on this as well, we see the complexity of this task, and part of the complexity is we're trying to be a lot of things to a lot of people, and we are succeeding in many ways. I do think that getting that quality experience, even if we're limited in some ways in our ability to provide the little wrinkle that every individual family wants, that will keep the quality of the overall in mind as well. So I was going to ask if this is too much customization. I won't ask that question. I'll put it out there just as a concern and kind of leave it at that. But hats off to the team, and look forward to hearing more developments as we go along.
Thank you.